know for sure if your TMJ-related tinnitus can be improved. Somatic tinnitus. It's tinnitus related to muscle and joint problems. Suggests to some that correcting the muscle and joint problems will fix the tinnitus. That's very intriguing, but is it true? Add to that, some people believe that if you have no significant hearing loss, it's almost certain that your tinnitus is a somatic type, related to muscle and joint problems. Add to that, some people believe that if you have no significant hearing loss, it's almost certain that your tinnitus is a somatic type, related to muscle and joint problems. In fact, they even believe that having tinnitus with no significant hearing loss means that you have a primary somatic cause, and correcting the somatic cause will reduce or eliminate your tinnitus. Well, that sounds exciting. We're left with 3 questions. Are they right? Can we know in your tinnitus case? And what if you do have hearing loss? Can your tinnitus still be helped with the same therapy? Today I'll answer those questions with certainty as it relates to TMJ issues and tinnitus. In the next episode, I'll answer those questions for the neck and other muscles. Dr. Levine, back in 2003, gives us 25 brief, forceful contractions that helps determine specifically if we have somatic-influenced tinnitus. These muscle contractions are done while sitting in a relatively quiet room. They last only a few seconds, just enough time to judge whether any change occurred in your auditory perceptions of pitch, loudness, location, or number of sounds. 10 contractions involve the jaw, 10 involve the head and neck, and the last 5 involve the arms and legs. Those arms and legs aren't important in my opinion, since Levine found that without exception, whenever the leg or arm maneuvers changed or created tinnitus, head and neck maneuvers also did this in the same way. Levine, in this same study, involved 62 people. Took a good study and made it great by showing the limitation of somatic modulation. Recall that somatic modulation is the change of tinnitus perception through muscle or joint motion or pressure. The limitation, he showed, is that even 58% of those hearing no tinnitus in a quiet room at the time of testing could create a tinnitus perception with one or more of those muscle and joint movements and tests. That means a lot of people without tinnitus can create tinnitus, at least for a few seconds. Perhaps it's possible that those people were more susceptible to tinnitus, but we just don't know, and we must consider it a limitation until we know what to do with it. So although you can say you have somatic-influenced tinnitus or even somatic-generated tinnitus, it doesn't seem to get us any closer to a solution, at least without some more information. Do we have that critical information? I'm so glad you asked, because you know that I did. So yes, Dr. Wright gave us this answer way back in 1997, interestingly, even before Levine's paper. So his work was specific to TMJ disorders and tinnitus. He used some similar tests, but the key was that he also did treatment, combining the test with the treatment to develop tests and questions to predict whose tinnitus would improve if they were treated. This is good research. So here are the tests. Each of these tests were performed to determine whether they reproduce or intensify the tinnitus in that person. First is maximum voluntary clinching. Bite on your posterior teeth, your back teeth, as hard as you can for 1 minute, but stop if you develop intolerable pain. Number 2, jaw movements. Maximally move your mandible to the right, to left, forward, and open. That's maximal. Number 3, pressure applied to the ipsilateral Tmj. TMJ on the side of tinnitus. So palpate the TMJ. The lateral pole, which is right at your joint, it's the most prominent bone of the jaw at the joint. So your mouth's going to be wide open. We'll palpate the lateral pole and then also palpate the back of that bone. It's called the condyle. Okay, you'll use 1 to 2 pounds of force for 1 to 2 seconds. Loading, number 4, loading of the ipsilateral Tmj. So while keeping your jaw open slightly, that's approximately 3 millimeters, just barely, not even half a centimeter, open your jaw and support the top of your head with one hand and push up with the palm of your head, palm of your hand on the other, with 1 to 2 pounds of force on the inferior border of the mandible, just in front of this angle, while the palm of your other hand supports your cranium. Okay? So push up, support. Just 1 to 2 pounds of force, not a lot. Keeping your mouth open. Okay, number 5, mouth opening against resistance. Open your mouth while with approximately 1 pound of finger pressure resist your opening. Okay. Number 6, mouth protruding against resistance. Protrude your mandible while applying approximately 1 pound of pressure to resist the movement. So last is muscle palpation. Identify the most tender areas of the muscles on the same side as the tinnitus using the pad of the index finger with 1 or 2 pounds of force for 1 to 2 seconds. The muscles that were tested, that you should test, are the deep masseter muscle, the lateral pterygoid, which is almost impossible to reach. I'll give you a link about that. The medial pterygoid, which is possible. That's on the inside. And you'll go on the inside of your teeth. So I'm not going to go through all the details of that, but it's on the inside. The sternocleidomastoid, that one's pretty easy, right? Turn your head and it sticks out here. This one you'll pinch your thumb and index finger along its full length. And finally, the posterior digastric muscle. That goes from your mastoid process to your hyoid bone, which is the bone that floats down here. So it's in between there. So these are the muscles they tested. I don't know why the temporalis muscle was excluded. I would have included it. Now, a positive test or significant test response on any of these was reproducing or intensifying the tinnitus. Now, here's some interesting findings from what they determined. 100% of those who had no tinnitus improvement after TMJ therapy had no significant test response. Okay? You'll probably have to look at these again later to figure this out. Also, 100% of those with any significant test responses did have tinnitus improvement after TMJ therapy. 33% of the tinnitus improvement people had no significant test responses, and 67%, it's the rest of the 100%, of tinnitus improvement people had any one of the test responses being significant. And finally, maximum voluntary clinching the back teeth for 1 minute was the only test that showed greater than 50% predicted power for tinnitus improvement after TMJ therapy. So what can we deduct from this study? This is actually amazing. We can use this evaluation to predict TMJ treatment. If TMJ treatment how can we use this? Right? We can use this evaluation to predict if TMJ treatment will reduce your tinnitus. If you have tinnitus and TMJ dysfunction, which is clicking, popping, or pain, or TMJ, and any one of those tests reproduce or intensify your tinnitus, you will improve. If none of these tests reproduce or intensify your tinnitus, 33% of you will still improve. Okay, I must qualify my statement somewhat. This was only a single study. It needs to be reproduced, but it's very encouraging. I'll save the fancy palpation specifics for those who are serious enough to get the Tinnitus Synergy program, or you can get a lot of it from my video, Home Trigger Point Therapy Evaluation. I'll save the fancy palpation specifics for those who are serious enough to get the Tinnitus Synergy program, or you can get a lot of it from my video that's already online, the Home Trigger Point Therapy for Tinnitus Evaluation. I'll link to those below. For now, I'll give you the easiest approach to know with fair certainty if TMJ therapy is likely a solution for your tinnitus. This falls into the section of, so what can we use now from this study? So this came from Dr. Wright's study. Ask yourself these questions. Are you younger in age, 18 to 63 years old? Is your tinnitus moderate rather than severe? Is your hearing normal? Did your tinnitus begin approximately when your TMJ symptoms began? Is your tinnitus worse when your TMJ symptoms are worse? Is your tinnitus stress-related? Is your tinnitus unrelated to loud noise? Is your tinnitus reproduced or intensified from 1 minute of maximal voluntary clinching on your posterior teeth? If most of these statements are true, you need to seek care for your TMJ dysfunction. It almost certainly will help your tinnitus. Or if you can, do the full evaluation yourself to know with even more certainty. And you can do your own TMJ self-care. Dr. Wright quotes others in saying that self-management has been reported to help 60 to 90% of the patients with TMJ disorder. Doesn't mean they got them totally better, but it did help. I'll give you a link to the self-care instructions in the description, and I'll be clearly explaining how to do the best therapy for TMJ disorder in one of my next videos. Now for future applications. What if there was an app with simple, clear videos that could walk you through this evaluation and the self-management solutions on your own? Or that you could share with a professional that was helping you? Also, what if this app could also connect you with a qualified audiologist, physical therapist, chiropractor, ENT, or other doctor trained to do this kind of work? The work that Dr. Wright said was shown to be effective was conservative TMJ therapy in a manner thought to be most advantageous for their TMJ disorder, end quote. That's not very specific, but the authors did give some references and a few specifics. For one, all subjects received TMJ dysfunction self-care instructions, and most also received oral splints. I'll cover those specifics in upcoming videos. I hope this has been helpful for you. Stay tuned for the next episode. I'll cover how to know if your neck, shoulders, or other muscles are definitely causing your tinnitus, and if treatment will help. The best way to stay connected to tinnitus research and therapy applications, as well as being notified of new therapies and video postings, is to subscribe to our email newsletter at tinnitussynergy.com. Thank you, and may God bless you.